30 plus international and national conferences in the graduation period, and also published over 10 plus research papers in several international and national journals, and also worked as intern doctor in NRI General Hospital, Mangalgiri. She worked as assistant professor in Sri Vishnu College of Pharmacy, Bhimvaram from April 2018 till December 2020. Thank you. Now I invite Dr. Pavani Saguti to share her valuable insights with us.
Hello, thank you, ma'am. Thanks for introducing about me. And good afternoon. Good afternoon, Dr. Uma, ma'am, the principal of Vishwanatha Institute of Pharmaceutical Sciences, and Dr. Erni Kumari and other staffs who are there, and the students, everyone, all of you. Good afternoon. I'm so happy to talk with you today. This is very great opportunity to me and you also. Guys, here PharmD students, right? Here all PharmD students or any other branch, ma'am?
B.Pharm students are also there.
Okay. Guys, you are in posted in hospital many times and every year from second year onwards to sixth year. The people, anybody here, just I'll ask only one question. You just give me your answer proper way. Anybody you reported adverse drug reaction? As a healthcare professional, you are doing healthcare professional work. In this scenario, you reported any adverse drug reaction, any medication error, any medical reconciliation? Anybody?
The students are from second, third, fourth, and fourth PharmD and third B.Pharm, I think, madam. Maybe they have not reported. And Yerni Kumari, you have to say about it.
No, madam. Yes, madam.
Yes, of
Ma'am,
course.
sorry for the interruption. Actually, I'm having a small network issue.
Uh-huh. Okay, no problem. Today we are going to discuss about building adverse drug reaction reporting culture for patient safety. This was September month. Actually, we were celebrating the patient safety and drug safety and in this scenario, actually, we were newly. This is very known to
Pavni
everyone.
ma'am.
Discuss about.
Pavni ma'am,
Yes.
your voice was not audible, ma'am. It was a bit clumsy.
Clumsy. Now is audible, ma'am?
Yes,
Hello,
ma'am.
ma'am. Is it audible now?
Yes, ma'am. Yes, ma'am. It was clear, ma'am.
Okay. Guys, I don't want you put in the too much elaboration and I don't want to long description. I don't want to do all this. I just give a few contents about the how to building a patient safety. Introduction to here some of the contents are I made. Introduction to adverse drug reaction reporting and patient safety. Madam, is it audible now? Proper way. And
Yes, ma'am, it's audible.
Okay. Introduction to ADR reporting and patient safety and the purpose of pharmacovigilance program and the current challenges in ADR reporting and what are the building a culture of ADR reporting, strengthening the national pharmacovigilance system and success stories of adverse drug reaction reporting impact and what are the action we take by the call or reporting or whatever the routes was there in reporting area reporting impact and finally I have to do give a small conclusion. Now we just discuss about What is an adverse drug reaction? What is an adverse drug reaction? It is an unintended harmful reaction to a medicine at normal doses. Very normal doses. If suppose we are giving 500 mg paracetamol thrice a day, but if it depends on fever, depends on temperature. At 6th hourly we have prescribed the medication, but at normal doses also is a harmful reaction to a medicine, that we call adverse drug reaction. Why ADR reporting is critical for patient safety? Why we are reporting ADR? Protects the patients from harmful effects of drug and informs regulatory authorities to take action. Regulatory authorities means we have regulatory bodies, and helps to improve the safe use of medicines. And what is pharmacovigilance? It is a branch of science, and activities related to detecting, assessing, and preventing adverse effects of drugs. It is a branch of science. First we detect in the case. For suppose, say once doctor how to diagnose the disease, same as well we detect the which drug is causing adverse drug reaction, that we do detecting, and then assessing the drug, and preventing the drug, and next planning the drug. These three contains detecting, assessing, and preventing adverse effects of drugs, that we call pharmacovigilance. That means drug safety. And what is the purpose of ADR reporting? What is the purpose of ADR reporting? Collect ADR reports from healthcare professionals and patients, and monitor drug safety across the country. And then for this, actually we are doing the monitoring. Then final the outcome is ensure prompt action to mitigate risks. So what are the risks is happened in prior or before or whatever, we give the ensure prompt action to mitigate the risk. And factors.
Shall I change the slide?
Factors affecting adverse drug reaction reporting. What are the factors involved in? What are the factors affecting adverse drug reporting? Under-reporting. Most of the doctors they're not reporting the adverse drug reaction. Under-reporting is a large number of ADRs go unreported. Large number in the one department. For suppose we take general medicine department, we take psychiatry department, we take dermatology department, a large number of patients every day come and go, but we are not reporting the areas go unreported way. So that fact, under reporting is one of the affecting area reporting. And lack of awareness is not there through the area. Like healthcare professionals and patients are often unaware of how or when to report. How to report the area, they don't know. When to report the area, they don't know. So lack of awareness is there. That's why National Pharmacovigilance Program of India last 17th to 23rd they celebrate National Pharmacovigilance Week only for the awareness program regarding adverse drug reaction reporting. And some of the fear of legal repercussions, like a concept over liability can discourage reporting. It's like if we report the something, if we are reporting about this drug, suppose if we are reporting about vaccination, if we are reporting any drug, this drug is not good, or any syrups, if we are reporting something, they will think like something will happen. So why this all this process we have to go through? So simply aram se just be calm down, like that everyone is thinking. So that's why ADR reporting is underreported. So there is so much fears are there, and the healthcare professionals also, and other who are health professionals, everyone's have. And time constraints. Busy schedules can lead to neglecting adverse drug reaction reporting. If for suppose bulk patients have sometimes patients coming 30, 40, 50. It's like busy, too much busy schedule also is leading that time of neglecting area reporting. And what are the strategies to and one more thing, one second. And most of the people, they don't know, some of the people, they don't know what type of things we are reporting, like adverse drug reaction we are report, only the adverse drug reaction will report, or medication errors also report. They don't understand regarding drug related problems. Medication errors is different and adverse drug reaction is different, but there is a very similar correlation in between these two. Understanding medication errors for safe medication use. As medication error means, it is defined as any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of the healthcare professional, patient, or consumer. Most of the mistakes where will happen, dosage mistakes. Dosage mistakes will happen. Incorrect amount of medication administered. Dosage mistake means like incorrect amount of medication administered, and wrong medications. I told some of busy schedule, some of time constraints. Because of these wrong medication, like taking a medication that was not prescribed, and timing errors, giving medication at incorrect times, frequency, okay, frequency of administration, and administration errors, drug administration errors, wrong method or route of taking medicine. And recently one of patient came to us, actually we just gave it to that patient Sitch bath method. Problem, piles problem. So that's doctor suggesting Sitch bath. Sitch bath is like water and betadine. In water they're putting they'll add in some betadine, like that, no. So they will think like that betadine solution they have to they were thinking like, okay, this one I used to take intake by mouth. They are thinking like that. That is very normal. Everyone knows. But some of innocent people, they don't know how to either external or now also people like that. So that kind of errors also there. Administration errors, wrong method or route of taking medicine. Then how to prevent medication errors? How to prevent medication errors? So we should always verify medications, double check labels and patient details. We should always check, verify medications. How to prevent medication errors is like verify medication, follow protocols, educate patients, and report issues. Like verify medication, double check labels and patient details, and for protocols, we should follow protocols means adhere to established guidelines for drug administration, and we should educate the patient. That means ensure patients understand the medication regimen and report issues. For those, that means have adverse drug monitoring centers. What are the strategies to improve reporting culture? What are the strategies to improve reporting culture? Education and training. Education and training is very important to organize the workshop, educate the patients, and
Audible.
Network in that room. Is it okay now?
Yes, for me, okay, ma'am.
Yes, ma'am. It is okay
Yes,
now.
ma'am.
It's okay.
Yeah. So encourage reporting by removing fear of blame or legal consequences. That matlab, like most of the healthcare professionals, they are thinking like you did that mistake, you did this medication error. So actually we are blaming each other. So this fear is happening nowadays. So don't blame, because we have so many physical things and mental things and so many things we have. So errors definitely will happen, but we will always we think about how to reduce medication. We always focusing on that, how to reduce medication errors. So then definitely it will come good progress. And simplify reporting. Develop easy to use adverse drug reaction reporting platforms. And patient involvement. Patient involvement also very much needed. Sometimes we don't give a chance to the patients. Sometimes we just dumbing them. So don't do that. Educate the patient importance of reporting adverse drug reactions. So if anything is happened, if something is happened, for suppose you're not well today, you're taking the medication today, you start to using the medication. If anything will happen tomorrow, you just take next day also. If suppose you have any itching reactions or any shortness of breath, any vomitings or nausea, this kind of problems is you are experiencing, the medication and immediately consult a doctor. Like that we should always educate the patient so that we will come to reduce all medication errors. And steps to strengthen the system. How to strengthen this ADR reporting system. Collaborating the healthcare providers and pharmacists and pharmaceutical companies and regulatory bodies. And you family people and family students and other BVAMS students, everyone they knows uh, very brief information about the if something is happened, if reaction is happened, what will do. And you people also to educate the doctors also. Why? Because they are always focusing on what is the what is the history and what is the diagnosis. They are always focusing on that. They don't most probably they don't focusing on medications related. So you we always coordinate with doctors and also pharmacists and also pharmaceutical companies and other regulatory bodies. And some of automation, like we should use some digital tools to streamline reporting and data collection. Like we have a tools like a toll free number, and we have a links, and we have Instagram, Facebook, Twitter. So many tools was there, so we should use. And data analysis, and to implement robust mechanism for analyzing adverse drug reaction reports to identify trends and risks. Once we reporting the adverse drug reaction, it will go to one place to another place, one place to another place. Finally, it reaches WHO. So data analysis also there. And public health impact also. Use pharmacovigilance data to guide drug safety regulations and to improve the patient care. All of you just listen about the one case example, how to once the person reporting the adverse drug reaction, it will goes to a peak area. It's like one example I want to give you. Check. One case example, that is rofecoxib, is a non-steroidal anti-inflammatory drug. This one marketed as Vioxx, Vioxx, was widely used to treat osteoarthritis and acute pain. Same like when we are in COVID time, no, that time remdesivir is a very widely used, no. Same like that time, 2004. This one rofecoxib, that one to treat osteoarthritis and acute pain, initially considered is very effective. It became clear through post marketing reports of adverse reactions that there was an increased risk of cardiovascular events including heart attacks and strokes. And after that, reporting, that one ADR reporting, once they reported adverse drug reaction report, post marketing surveillance and adverse drug reaction reports revealed significant concerns. Studies, including those based on ADR data, indicated a substantial risk of serious cardiovascular events associated with long-term use. Over time, numerous adverse drug reaction reports contributed to a growing body of evidence suggesting that the risk of the benefits for many patients. In 2004, one person, Merck, he is voluntarily withdraw rofecoxib from the market due to our safety concerns. This case led to stricter regulations and greater transparency in drug safety evaluations. The Food and Drug Administration and other regulatory agencies now require more rigorous post-marketing surveillance for similar drugs and ensuring early detection of potential risk. This ensuring is like early detection of potential risk. So this example highlights how vigilant ADR reporting can prevent widespread harm and save lives. And finally, what the outcome we see in improved drug safety regulations and enhanced patient safety. Drugs like rofecoxib to significant increase in drug regulations and better safety measures. As a result, that time stricter monitoring of patient safety and regulatory oversight and reducing the risk of future adverse drug reaction and improving public health outcomes. By in this scenario, you people just how this is one example. And next, for healthcare professionals, report all suspected ADS, no matter how significant it's minor. This is very minor. This is very moderate. This is so no need to report like this. Don't think like a report known for patients. What we gave a just we always counsel, not counsel, we always aware the healthcare professionals. Doctor, no problem. Whatever common areas also you can report to me. This is very good thought to process. Why we once we reporting the common adverse drug reaction also, we have a good potential, great potentialities we can get. So please report very common adverse drug reaction also. Like that, we should always aware the healthcare professional. For patients wise, how to counsel, we be we for patients related, you're taking the medications, like you have a past history of diabetes, you have a past history of hypertension. Now you came with the complaints of some pain, body pains or osteo pain, whatever they're complaining. So for this we are giving the medications, and past medications also you should any problem is nothing will happen. If anything is happen, you just stop that medication. and come to me once visit me, like that you we always aware the patient. That means it's a very good progress in our healthcare sector in India and more widespread. And ADR reporting is essential for protecting patients and ensuring drug safety. It's a collaborative approach is needed to build a culture of reporting, and the pharmacovigilance program is a save lives and ensure safer healthcare system. And also, as a healthcare professional, you and me, we are the healthcare professionals. We are always to meeting is a global health need. We have to meet our global health and around the area, nearby area, and so on. And one more thing, pharmacovigilance in pediatric also. This is also you just noted. Pharmacovigilance in pediatrics protecting our young ones. Like adverse event reporting is crucial in children because of dosing challenges there. Like improper dose measurements might cause overdose. Okay, and physiological differences like underdeveloped body organs, different rates of drug metabolism. We know all. We every pharmacist know thalidomide effect, thalidomide tragedy. So same like physiological differences may be welcome. And polypharmacy, polymorphism, matlab use of multiple medicines might lead to drug interactions. I already told you, know, patient already using in the past medications, diabetes, hypertension, asthma, whatever. And now patient came with the complaints of some other chronic disease. So we and doctor prescribe the medication for whatever the condition. So multiple medications, diabetic medication, hypertensive medication, and now current medication. So all these medications it's a bulk. It's under polypharmacy. So we should always educate the patient. This you're using multiple medications. So if anything is happening, you just come to us, so that we will give better quality of life. We will do something. Any alternative we will do like that. And may cause doses and doses forms problems. So mostly is child experience any adverse drug reaction or side effect to a medicine like lymphadenopathy, vomiting, dizziness, skin allergies, and seizures. These kind of things we always we will so these kind of things are the channels for reporting adverse event. We have so many channels to reporting adverse event. Mine is Ains Mangalgiri. So nearby, like primary healthcare sector or rural area or urban area or any pharmacy college or any other NRI medical colleges nearby. So many so many colleges, so many medical hospitals, and so many clinics there. So they should report directly to me. And so nearest adverse drug reactions area. And also ADR reporting form. We have a ADR reporting form. You can go through www.ipc.government.in. We can get the ADR reporting form. And toll free number we have 1800 180 3024. We have a NCC NPW connect with connect with us like NPW hashtag NPW 2024. In that where Facebook and Twitter, LinkedIn, and YouTube, and Instagram, we can report website also. So these are the many channels we have for reporting adverse events. Not only not you can directly come to the same past doctor, you can come. If not you can directly to we have a channels, we can directly report to through by channels. And mm, spot it, report it, and prevent it. Your safety is our safety is our priority. So we always, once I have a itching all over my body since I took some drug. So what will do next? If suppose I have itching all over my body since I took some extra. If this occurred after taking the medicine, it might be an adverse drug reaction. We will think like, okay, something is happened. Next, we will think like maybe it might be an adverse drug reaction. So, patient always they're thinking like, once I took that medication, then after my body get itch, is that adverse drug reaction or not? They will think like, should I report this area? Like that they will think. Yes, definitely they will report it. Yes, definitely they should report. It will make authorities to aware about the adverse drug reaction. And as a pharmacist, as a healthcare professional, we should focus on public areas, public health sectors, because they don't know. They are going to simply they are going to some medical shops, simply any previous medications they are taking. If like previously, if suppose patient have any pains previously, that time one drug they took, so they get fine and everything they cure well. And then after 1 month also patient is taking same medication, because already they experienced in better way. So that's why they after 1 month also they are taking same medication. So after 1 month also they are taking same medication. They're not well. Already something is happening inside their body. Some urine output is something is happening, kidney affecting something is happening, but they don't know. But simply they are going to medical shop, and so these most of the patients we most of it's a higher chronic diseases. So in this way we should always educate the patient, and we should focus on medication errors, and we should always on literature things, research updates, and we should always focus on research updates. We should always focus on drugs update. So definitely, okay, the so and so drug you are taking, then immediately we can give one precautionary word to patient. So that way we are doing, so it will at least little bit we can save the patient. So these kind of things we should follow as a healthcare professional. So finally, what I want to tell is building a strong adverse drug reaction reporting culture is critical for safeguarding patients and improving public health. Together, we can improve patient safety through vigilant adverse drug reaction reporting. Thank you. Any doubts?
Good afternoon, madam. As such, I don't have any doubts. But if you can explain any adverse drug reaction you faced there or you reported there in our local language, maybe our students will connect to it.
Yes, ma'am.
అంటే మీరు ఏదన్నా అక్కడ అంటే మీరు చూసి ఇది మనం ఎవరికన్నా చెప్పాలి అనుకున్నది కానీ ఏమన్నా ఉంటే
Yeah,
అది
yeah.
మీరు తెలుగులో చెప్పారంటే తొందరగా కనెక్ట్ అవుతారు. మనం కూడా ఇలా చేయొచ్చు అని అనుకుంటారేమో అని అడుగుతున్నానండి.
ఓకే ఓకే. Ebony,
Yes, ma'am.
can you share
Madam,
నా స్క్రీన్ చేయనా?
didn't get you.
Okay, ma'am, no problem. I want to share my screen, ma'am. At least I'll send you one link. Can you please open in your ma'am, I shared you one link. Can you open that one? Possible? Hello, ma'am. Recording so many areas like in so many areas generate so many adverse drug reactions associated adverse patient. And in male case, we report a rare case of a drug-induced hyperprolactinemia and gynecomastia in a 29-year-old adult male patient diagnosed with psychotic depression, taking amisulfide 50 mg OD and fluoxetine in addition to other cardiac medication for his cardiac disease. He complaining the some psychotic depression and also he complaining the some cardiac issue is there. So as well and fluoxetine also we added. So however, after reducing the amisulfide dose 25 mg OD of prolactin, size of the breast. Eventually, amisulfide was withdrawn and the levels of prolactin decreased to normal levels along with reduced size of breast. We reported that one case. A patient had actually the one is drug-induced hyperprolactinemia associated with disorders of the hypothalamic pituitary axis. This one 29 he is an unmarried person. He had a diagnosed with psychotic depression and suffered from both symptoms of depression and schizophrenia due to sudden demise of his father, which is psychiatrist prescribed a tablet amisulfide 50 milligram once per day and tablet fluoxetine 20 mg 2 times per day. He had a history of embolic stroke since 5 years back. Already he had a past history embolic stroke. Left side, but it is that one he did obstructive cardiomyopathy at the age of 21 years, and he successfully underwent mitral valve replacement also that time. After which he had prescribed the tablet aspirin 75 milligram per day, and also warfarin milligram per day, and tablet bisoprolol 5 milligram per day, and torsemide 5 milligram per day, and rosuvastatin 5 milligram per day. This is the his medication chart, what he is using regular medication. He had a hospital, Ames Hospital. So, with chief complaints of he had a increase, breast size is increased. He's a male patient. Okay, the chief complaints of bilateral increase in the size of the breast and pain over during his regular visit to the psychiatry outpatient department. Psychiatrist advised the patient to get test of serum prolactin levels. Psychiatrist doctor, he advised serum prolactin levels. So the report has shown increased levels of prolactin 50.87 nanogram per deciliter. Then the psychiatrist dictates the dose of tablet emisulfate 25 milligram once a day. However, even after reducing the dose of emisulfate to the previous examination and now examination, and after prolactin levels examination, none of the other medications co-administered with emisulfate during the course of treatment were known to cause hyperprolactinemia and gynecomastia. Therefore, the psychiatrist withdrawn the tablet emisulfate immediately, but to continue the tablet fluoxetine. After 1 month, patient had come to the hospital for regular checkup to psychiatrist, and he had advised to the test for prolactin levels, and the report has shown 8 nanogram per deciliter. That is the normal prolactin levels. So then we stopped that medication. Already we stopped that medication. Then once we stopped that medication, then we checked prolactin levels. So now patient feels better. Considering that the patient needs to continue taking medication for the psychotic depressive symptoms. So switching to another drug in other class of antipsychotics, such as atypical antipsychotics, which are not associated with hyperprolactinemia, the psychiatrist prescribed him a tablet olanzapine, starting initial dose 0.52. Now patient he is using 2.5 mg. So as per we are using WHO causality scales, if this is the case, is like probably 9, almost out of 13. Actually, we are given the 13 score is 13 out of 13. 9 score is 9. So we definitely considering the that emisulfide induced increase in the prolactin levels. Here యాక్చువల్లీ 2021లో పేషెంట్ వచ్చారు మా దగ్గరికి. పేషెంట్కి ఆల్రెడీ వాళ్ళ ఫాదర్ చనిపోక ముందు, వాళ్ళ ఫాదర్ విషయంలో బాగోనప్పుడు ముందు ఆ పేషెంట్కి ఆల్రెడీ కొన్ని ఇష్యూస్ ఉన్నాయి, కార్డియాక్ ఇష్యూస్ ఉన్నాయి. సో ఆ 21 years లోనే కార్డియాక్ ఇష్యూస్ ఉంటే ఆ పేషెంట్ కి మేము కొన్ని మెడిసిన్స్, జనరల్ మెడిసిన్ డాక్టర్ కొన్ని మెడిసిన్స్ ఇచ్చారు. లైక్ ఆల్రెడీ ఐ టోల్డ్ యూ నో, aspirin tablet and warfarin tablet, bisoprolol and torsemide and rosuvastatin. Patient is under all these medications అన్నమాట. అండ్ 21 అప్పటి నుంచి వాళ్ళ ఫాదర్ ఎప్పుడైతే డిస్మైజ్ అయ్యారో ఆ తర్వాత నుండి పేషెంట్ కంటిన్యూగా సైకియాట్రీ డాక్టర్ కలుస్తా ఉన్నారు, కండిషన్ వల్ల, డిప్రెషన్ అండ్ సైజోఫ్రెనియా ఆ సిమ్టమ్స్ ఉండటం వల్ల. సో పేషెంట్ కి 50 ఇస్తా ఉన్నారు. 50 mg తీసుకున్నారు పేషెంట్. సో కొన్ని డేస్ తర్వాత, కొన్ని ఇయర్స్ తర్వాత పేషెంట్ మన దగ్గర 2 years దగ్గర తర్వాత అది పేషెంట్ రాలేదు, అంటే కన్సల్టేషన్ కి రాలేదు, కంటిన్యూస్ ఫాలో అప్ లేదు పేషెంట్ కూడా. సో ఆ కంటిన్యూస్ ఫాలో అప్ లేకపోవడం వల్ల మళ్ళీ 2 years కి బ్రెస్ట్ సైజ్ ఇంక్రీజ్ అయిపోయింది, సమ్ ప్రొడక్షన్స్ కూడా జరుగుతున్నాయి, సమ్ డిశ్చార్జెస్ జరుగుతున్నాయి అన్నట్లు పేషెంట్ మన దగ్గరకు వస్తే అప్పుడు ఏం చేశారంటే 25 mg కి ఎమిసల్ఫ్రేట్ డోస్ ని తగ్గించి డాక్టర్ అడ్వైస్ చేశారు ప్రొలాక్టిన్ లెవెల్స్ చెక్ చేయడానికని పంపించారు. సో ఇన్ ద ఇన్వెస్టిగేషన్స్ లో ప్రొలాక్టిన్ లెవెల్స్ టూ మచ్ గా ఇంక్రీజ్ అయిపోయింది. సో ఆ తర్వాత కూడా ప్రొలాక్టిన్ లెవెల్స్ ఇంక్రీజ్ అయినా కూడా పేషెంట్ కి ఆల్రెడీ ఉన్న కండిషన్ బట్టి ఎమిసల్ఫ్రేట్ అనేది చాలా బాగా వర్క్ అవుతుంది పేషెంట్ కి. సో అక్కడ ఏం చేశారంటే 50 mg నుంచి 25 mg కి చేశారు. అయినా కూడా నెక్స్ట్ ఎగ్జామినేషన్ కి మళ్ళీ పేషెంట్ వచ్చారు. మళ్ళీ పేషెంట్ నెక్స్ట్ ఎగ్జామినేషన్ కి వచ్చినప్పుడు ప్రీవియస్ ఎగ్జామినేషన్ ఏదైతే పేషెంట్ చేసామో అదే ఎగ్జామినేషన్ ఉంది, కానీ ఆఫ్టర్ 25 mg డోస్ తగ్గించినా కూడా పేషెంట్ లో ఎలాంటి చేంజెస్ లేదు, సేమ్ ఎగ్జామినేషనే ఉంది. సో అప్పుడు డాక్టర్ ఏం చేస్తారంటే ఇమ్మీడియట్ గా అసలు ఎమిసల్ఫ్రైడ్ డోస్ ని ఆపించేసి ముందు ఈ ప్రొలాక్టిన్ లెవెల్స్ ని ఎమిసల్ఫ్రేట్ ఫుల్ గా ఆపేయించి వలాంజిపైన్ వెరీ నార్మల్ డోస్ నుండి ఇనిషియల్ డోస్ నుండి స్టార్ట్ చేసి ఈ ప్రొలాక్టిన్ లెవెల్స్ ని తగ్గే వరకు చూసారనమాట. ప్రొలాక్టిన్ లెవెల్స్ తగ్గడం చూసిన తర్వాత నెక్స్ట్ లైక్ కార్డియాక్ మెడికేషన్స్ కూడా మళ్ళీ ఏమన్నా పాలిఫార్మసీ జరుగుతున్నవి ఈ రెండింటి మధ్య మన మెడికేషన్ ఎర్రర్స్ జరుగుతున్నాయా అనేది మళ్ళీ చూసి ఆ తర్వాత నెక్స్ట్ వలాంజిపైన్ తో పేషెంట్ కంటిన్యూగా అయ్యారు. నౌ పేషెంట్ సమ్ వాట్ బెటర్ అండ్ ప్రొలాక్టిన్ లెవెల్స్ ఎవ్రీ 3 months చెక్ చేయిస్తా ఉంటాం. ప్రొలాక్టిన్ లెవెల్స్ ఎప్పుడు కూడా నార్మల్ గానే ఉంటున్నాయి. సో దిస్ ఈస్ ద వన్ కేస్, దిస్ కైండ్ ఆఫ్ నౌ పేషెంట్ హీ ఈస్ టేకింగ్ 2022, last 2022 he came to the hospital. That time we started 2.5 mg. So patient is okay, but nowadays his follow up very poor. Follow up kuda ravatledu. So this is the one case we observing, and while we observed so many rare when patient is taking chemotherapy under chemotherapy cycle, patient in the hospital DOCETAXCL, docetaxel, we use that drug, and after it is getting like pneumocyosis, pneumonia, docetaxel induced pneumonitis. So these kind of cases directly like this, and common cases we observing every day, we observed in antibiotic antibiotic resistance case, continuous uses of medications, they will get like output, urine output conditions also we see. And so like we saw many cases. So one case so this is for example
క్లాస్ లో వినిపించట్లేదా?
సిగ్నల్ లేదు మేడం, ఫ్లక్చుయేట్ అవుతుంది.
And we just focusing on medications, not only medication, we always focusing on investigations also, laboratory investigations we should always focus. Like first, suppose in ortho conditions we are taking so much painkillers, definitely some of investigations may vary. Once investigations when we'll see in, abnormal things in investigation, definitely it will lead, it's like some external changes is happening, that also we should consider. So laboratory investigation, ATT medication always to regulate the leverage abnormalities, the hepatotoxicity. So these kind of many. So we should always focusing once we are prescribing the medication, we always at the same time our role focus on laboratory investigation. Our role means what? Medication errors. And once we consider, once this is the adverse deviation, this is the medication errors. Once we consider, definitely we should report. Then we once we report the good effort. So let's all together we can improve patient safety through safety ADR reporting, vigilant ADR reporting. Thank you, ma'am. Any doubts you can ask.
Kumari, if any of the student is having doubts, you can take them.
అండి కిరణ్మయ్
Ma'am.
మేడం డౌట్స్ ఏమో స్టూడెంట్స్ కి అడుగుతున్నారు.
Savitri madam hand raise చేశారు.
The subject pharmacovigilance will okay.
2 to 3 days యూస్ చేసుకుంటున్నప్పుడు ఇంకా ఇంకా సరిగా డాక్టర్ని కన్సల్ట్ అవ్వండి. లేకపోతే పారాసెటమాల్ వాడేటప్పుడు మచ్చలు లాంటివి శరీరం మీద మచ్చలు లాంటివి కనిపిస్తాయి, అబ్జర్వ్ చేయొచ్చు. సో ఇలాంటివి ఉన్నప్పుడు మీరు ఖచ్చితంగా డాక్టర్ని సంప్రదించండి. లేకపోతే ఇంకా మనం తీసుకునే మెడికేషన్ లివోస్ చెప్పొచ్చు. లివోసిట్రిజన్ అసలు ప్రతి ఎవరైనా కూడా ఈజీగా తీసేస్తున్నారు. యాంటీ హిస్టమైన్ కూడా యాంటీ హిస్టమైన్ ఆల్సో బర్నింగ్ లైక్ బాడీ మీద రెడ్నెస్ రావడం లైక్ సెన్సిన్స్ ఇలాంటివి ఉంటాయి. చాలా మంది సిట్రిజన్ లాంగ్ టర్మ్ యూసేజ్ చేస్తూ ఉంటారు. ఎలా అంటే 7 డే 5 డేస్ 7 డేస్ 10 డేస్ అలా యూజ్ చేస్తూ ఉంటారు. మోర్ దెన్ 1 మంత్ యూజ్ చేసిన వాళ్ళు కూడా ఉంటారు. హైపర్టెన్సివ్ కానీ ఈ కండిషన్స్ ఉన్నప్పుడు ప్రాబ్లం తీసుకురావచ్చు. ఎందుకంటే అలాంగ్ విత్ డయాబెటిక్ అండ్ హైపర్టెన్సివ్ మెడికేషన్ డెఫినెట్ గా పేషెంట్ ఏదైనా పారామీటర్ చూసుకోవడం కాన్షియస్ కూడా చాలా బెటర్. కొంచెం like daily usage medications ఇంకా సిరప్ చాలా మంది షేక్ చేసి తీసుకోవాలి. ఎందుకంటే రీసెంట్ గా ఒకటి ఎట్లా అంటే ఫుల్ షేక్ లేదు. ఎలా అంటే షేక్ లేకుండా సిరప్ మామూలుగానే తీసుకున్నారు. ఆఫ్టర్ 3 days తర్వాత సిరప్ అడుగుకు వచ్చేస్తుంది కదా, ఆ సొల్యూషన్ ఆ సస్పెన్షన్ మొత్తం తీసుకొని ఇట్లా తాగేయడం. అంటే నాట్ డైరెక్ట్లీ బై యాజ్ పర్ లైక్ ఫుల్ ఆఫ్ సెడేషన్ అన్కాన్షియస్ టైప్ లో వెళ్ళిపోయారు. సో సిరప్స్ విషయంలో కూడా మనం పేషెంట్ ని కేర్ఫుల్ గా ఉండాలని చెప్పాలి. సో ఇలాంటి కొన్ని మెడిసిన్స్ తీసుకున్నప్పుడు ఈ మెడిసిన్ లో మీరు ఇలాంటి కాన్షియస్ గా ఉండండి. ఒకవేళ ఎలాంటి ఇబ్బంది వచ్చినప్పుడు మీరు ఇలా డాక్టర్ ఇలాంటి చెప్పడం.
థ్యాంక్ యూ.
అంటే మనం కంటిన్యూ రెగ్యులర్ గా యూస్ చేసిన గురించి చెప్తున్నాను. ఎవరికైనా ఈ సిట్రిజన్ కొన్ని మెడికేషన్స్ ఈజీగా వాళ్ళకి తెలిసిపోతున్నాయి. సో వాళ్ళు ఓన్ సెల్ఫ్ మెడికేషన్ తీసేసుకుంటున్నారు.
ఈవెన్ యాంటీబయాటిక్స్ లో కూడా జరుగుతుంది కదా అలాగా. యాంటీబయాటిక్స్ ఆర్ ఆల్సో వెరీ కామన్ ప్రాబ్లమ్.
మనం పేషెంట్ హౌ టు ఎడ్యుకేట్ అంటే సపోజ్ డాక్టర్ ఉన్న కండిషన్ బట్టి, లేకపోతే ఇనిషియల్ గా ఏ టెస్ట్లు లేకుండానే కొన్నిసార్లు ఏం చేస్తామంటే 3 days కోర్స్ ఇస్తాము, కొన్నిసార్లు 5 days కోర్స్ ఇస్తాము. ఇఫ్ 7 days కోర్స్ ఇవ్వాలంటే ఖచ్చితంగా కూడా టెస్ట్లు ఉండాలి. సో 7 days కోర్స్ ఈజీగా ఎవరు ఇవ్వరు. మోస్ట్లీ 3 days ఆర్ 5 days కోర్స్ ఇస్తారు. చాలా మంది పేషెంట్స్ ఏం చేస్తారంటే 3 days కోర్స్ ని 1 or 2 days వేసేసుకొని ఆ 2 days ఆపేస్తారు. అంటే తగ్గిపోయింది, నాకేం ప్రాబ్లం లేదు అనేసి ఆపేస్తారు. అక్కడ ఏమవుతుందంటే యాంటీబయాటిక్ రెసిస్టెంట్ ఆఫ్టర్ 10 days తర్వాత అయినా మళ్ళీ అది బాడీకి రెసిస్టెంట్ అవుతుంది. సో పేషెంట్ ఎలా ఎడ్యుకేట్ చేయాలంటే యాంటీబయాటిక్ 3 days చెప్తే మీరు కరెక్ట్ గా 3 days వేసుకోండి. ఒకవేళ 5 days చెప్తే కనుక 5 days వేసుకోండి. ఈ యాంటీబయాటిక్ యూజ్ చేసే క్రమంలో మీకు ఏదైనా మీకు శరీరం మీద కానీ, లేకపోతే మోస్ట్లీగా వచ్చేది షార్ట్నెస్ ఆఫ్ బ్రెత్, అలాంటిది మీరు ఏమన్నా ఈ మెడిసిన్ వల్ల గమనించారు, అబ్జర్వ్ చేశారు అనేది మీకు ఏమన్నా అనిపిస్తే వెంటనే అది మందు ఆఫ్ చేసి మీరు ఇమీడియట్ గా డాక్టర్ ని కలవండి. ఇలా యాంటీబయాటిక్స్ విషయంలో ఇలా మోర్ దెన్ 7 days అండ్ 9 days 11 days ఇచ్చే యాంటీబయాటిక్స్ లో ఖచ్చితంగా డాక్టర్ ఇన్వెస్టిగేషన్స్ బేస్ మీదే ఇస్తారు. సో దాని విషయంలో కూడా పేషెంట్ అది 7 days 11 days 7 days 9 days 11 days ఇవన్నీ ఇచ్చేది కూడా ఐపీ సెక్టర్ లో ఇస్తారు కాబట్టి, సో అది మనకి అంతగా హార్మ్ చేయకపోవచ్చు. కానీ అవుట్ పేషెంట్ సెక్టర్ లో మనం చూస్తే మోస్ట్లీ 3 days 5 days కోర్సులో ఎక్కువ ప్రాబ్లమ్స్ ఫేస్ చేస్తున్నారు. సో ఈ విషయంలో మనం ఎప్పటి వరకు కోర్స్ ఇచ్చారో అప్పటి వరకు మీరు యూజ్ చేయండి అనే విధంగా మనం ఎడ్యుకేట్ చేస్తే మంచిది. ఒకవేళ మీరు మధ్యలో ఆపేస్తే మీకే మళ్ళీ రెసిస్టెంట్ అవుతుంది అనే దాని గురించి కూడా మనకి వాళ్ళకి ఎక్స్ప్లెయిన్ చేస్తే దే విల్ టేక్ వెల్.
సో మేడం, ఇలాంటి ఫార్మకో విజిలెన్స్ వీక్ కానీ different programs we are conducting among pharmacists and doctors, but they are not reaching the patient. But in 1 or 2 corporate hospitals what I have observed, daily they're taking some PPT presentations to outpatients also. They're making them to sit there because anyway, making awareness among the patient. I think that will be better to propagate idea is the very important we can import week. We are celebrating so many pharmacists on the college, but we are not reaching the patients.
Yes.
For that, can you find out some solution,
Yes,
madam?
ma'am. Like do one it's like public ma'am. It's like pamphlets కానీ leaflets కానీ అలా ఇవ్వడము హాస్పిటల్స్ లో పోస్టెడ్ సో అయిన స్టూడెంట్ డ్రగ్ ఇన్ఫర్మేషన్ అండ్ పేషెంట్ కౌన్సిలింగ్ ఇస్ బెటర్ good action for to reaching the patients, drug
Thank you.
information and patient counseling. So we should do like
Thank you.
uh,
Some hospitals they are doing it, but not all.
yes, ma'am.
Thank you, madam. Kumari, are you available?
Thank you so much, ma'am.
Thank you, ma'am.
Thank you so
Thank you
much
for
for
your
addressing.
insightful presentation.
Thank you, Pavane madam. We are very happy about you addressing our students. Next time, we would like to invite you directly to our institute so that these problems will not be there and our students can communicate with you well. Thank you so much, madam. This time, we will inform you prior, and if there is anybody else who can address, please advise us.
Yeah, ma'am.
Thank you so much.
Thank you, ma'am. Thank you so much.
Thank you, ma'am. Thank you for sharing your knowledge, ma'am, with us.
Thank you.
Once again, heartfelt thanks, ma'am.
Thank you, Andy.